Well. Good morning, good noon to everyone. It's actually a very pleasure to be here. I'm going to talk about something that I love. It's wellness is my life. I live, breathe, and speak wellness. So I'm very pleased to share what I've been doing for several years now, maybe 2 decades. And my topic for this morning will be creating a workplace wellness program. It's actually fitting that I was, I think, the fourth to speak about this because I think early on, Dr. Macabulos talked about occupational health and its programs in the companies and in the country, and then followed by, I think, something on mental health, which is very, very important these days. And then I think there was a company who won the best wellness program, and I think that company best exemplifies what I am going to talk about. So moving forward, just a disclosure, while I'm an internist, I'm an adult specialist, I'm also into aesthetics and anti-aging, so if you want to look much younger, well, I'm also an occupational health doctor, I'm a health and wellness advocate. I think my Facebook page has garnered like 25,000 members already, so we update it every time and give tips on keeping ourselves fit. I'm a certified clinical researcher, I'm a model and a host on the side, but I'm not connected with any wellness companies, except for Jardine, which is an insurance broker. So anyways, my agenda for this morning, I hope I will not bore you, but I would like to reintroduce wellness in the corporate setting, and then of course tell you the value of wellness, not just well, it's productivity, but the whole gamut of wellness. Also give you the steps to wellness that I think you can bring home to your companies and to your, well, your families, and then summarize at the end. So I was asking people around, trying to do my research, what generation are we in now? Sad to say, I've got this letter O. Before it was X, there was Y, and all these letters or alphabets. But then they said O, and I'm like, oh my God, why? So people, and then a research was shown that says because of some lifestyle changes, then a lot of our employees are becoming overweight, and this I have seen because in my company I analyze over 300 companies' utilization. So then most of the top illnesses would center on overweight, bad. Overworked, that's mental stress, that's part of it. And then because of that, it results to overstressed. So reintroducing wellness. Wellness is not just the absence of a disease. It's not that you're not sick, you're feeling good, that's already wellness. Wellness now was expanded to about 7 dimensions, which includes physical, intellectual, emotional, social, spiritual, occupational, as Dr. Macabulos mentioned earlier, and then of course environmental, because if your environment is not pretty much suited for you, then you cannot move away your environment, you just have to move from that environment towards a better one. Moving forward, I have few slides with texts, but this is one of the most important part. When we say or when we talk about workplace wellness, it is any workplace health promotional activity or organizational policy. Let me reiterate that. It should be a policy, meaning HR, the leaders, the management and admin should be able to tell their employees that, hey, this is part of our business. This is part of our work. This is part of our life. So let us do it. Okay? So it's designed to support healthy behavior and improve health outcomes, also known as corporate wellness. And examples would be weight management programs, on-site fitness programs, and others that I will mention later on. So wellness programs, around the world, there has been a hype with creating wellness programs. In the US, about only 85% of their companies have it, but only like 40% of employees would actually participate. And only if they're incentivized, meaning if there's something in it for them. They have to be given a voucher, a free whatever, or something for them. In the Philippines and in Asia, luckily or happily to say that it's growing, there's a growing numbers, about 45% of the companies are starting wellness programs, but only little steps, tiny steps. I think I only know very few companies who have wellness programs that are actually being in place and being very effective. And I'm happy to say that one company is doing it pretty much and pretty well. So what are the benefits? My bosses would always tell me, hey, Dr. Arah, what have you been doing? What are you trying to do in the company? And I say, sir, you do not do wellness overnight. It will not change people overnight. I do not just stand here and tomorrow you say you want to be fit like me. Because I've been trying to be fit myself for, almost 40 years now. But what I'm saying is, number one is to be aware first. I am here because I want everybody to know that, hey, health is more important than anything else. In fact, if I tell my clients, the best investment that you can ever have, not a Hermes bag, not a very beautiful house, but probably, or most likely, your health is the best investment. So that's health awareness, number one. Followed by, then if your employees in your company is aware about their own health and wellness, then you develop a culture. I think that's an important word here, culture. And then if people know what it means to be healthy, then they are empowered. They are able to do it because they want to for themselves. And then of course, like for me, if I know that if I eat healthy, like in our company and most of our companies, I would say, make your Fridays no fried Friday. So in the pantry, you're not supposed to see anything fried. So it should be boiled, eaten raw, or do something else instead of frying, because that would decrease about 20 to 30% of the calories of what you're eating. So that in itself is being proactive about your health. You have to do it every day. It's not like, okay, we have a wellness fair today, everybody comes in, everybody gets freebies, and tomorrow they forget about it. So it has to be sustainable, something that's done every day, because if you are able to implement it pretty well, then it increases productivity and effectivity of your employees. And of course, as we say, they become happier at work. So what are the keys to an effective wellness program? I am very, very honored to be here, and I believe you people here are the key to a very good wellness program. It does not usually start from the employees. No employee would just raise his or her hand and say, let's have a wellness program. They might be heard, but usually it should start with the leaders. So I'm telling everyone to, when you come back to your work, please make it part of your policies to be aware of their own health. And let's start it in our own companies. But number one, of course, you have to make a plan, because you plan to fail if you fail to plan. So come up with a good plan. You can consult us. Jardine Lloyd is always there. We can help you create your own wellness program. But what I'm trying to do today is to give you the steps so that when you go back, you wouldn't need a broker. Well, you can still need us to do it on your own, okay? Of course, strategize. If you have a good strategy, you will be able to execute it. And then, as I think mentioned earlier, you have to be able to measure what you've been doing. Don't spend too much money and forget about it afterwards. You have to be able to check if it's doing something. For example, you ask everyone to be vaccinated. Okay, there's flu vaccine. In fact, lately I've been asked, Doctora, can you deliver a lot of, what was that? Japanese encephalitis vaccine to our company. And I'm like, yeah, it costs several thousands. It's okay, no problem. The company can pay for it. But no, it's not like that, you know? You have to be able to plan it first, check your budget, and then what it's going to do to your company before you even implement something. Because, of course, I would say vaccination is very important, but try to figure out if you vaccinate everyone, if that would do any good. Because for all you know, Japanese encephalitis, you don't have to vaccinate everyone. I'm sure you know that, right? There was a scare, but you only vaccinate those who are exposed. And particularly those young ones, 9 years old and above, that has been traveling and has been exposed. You don't need to vaccinate the whole family unless you keep traveling to Asia. Well, and you have the money, why not? We can talk about that later. So, if your company, if your employees are unhealthy, are sluggish, are tired, then probably they will end up unhappy and not doing the right job. So wellness is part of that. So this picture we did, I've been partnering with Fit Philippines. I'm pretty sure they've even come to your offices or your companies. They have a good advocacy, and I hope you join them. We are extending up to next year, although we are awarding the winner for this year, the company who lost the biggest weight. Okay, so this is very good. Everybody will pledge a pound to lose, and then the company with the most pounds lost will win. So in this case, well, I think I pledged several times, so I think I lost 4 pounds because I pledged 4 times for different companies. But yes, you can do that. Because healthy people mean better for business. Not that we want to think about it as a money matter or that it would cut on utilization. But if you do invest on your people, and most companies would say they don't have a budget, it's difficult to do this because money is tight. But according to studies, in fact, the RAND study in the US was conducted, and every $1 invested in an employee wellness program, it would actually yield you about $4 worth of savings through reduced sick days, higher productivity, and decreased overall health cost. You might be wondering why I keep walking around. It's because when you do fidgeting, like what I'm doing now, I'm actually losing about 80 calories if I stand up here for 45 to 1 hour. So what I'm telling my employees and my people is that you don't need to sit all the time. I'm talking here, you can just keep walking around, you can fidget, because that will make you lose more calories. Okay? You don't need to sit all the time. That's not wellness. Anyways, you might forget everything that I said, but this picture you might want to keep in mind. These, according to studies, are the steps to wellness, which you can bring home, share to your employees or your companies. Number 1, of course, assess the need. You cannot just come up with a program without analyzing the need of your employees. So how do we do that? Number 1 is through utilization. Utilization is very specific. Besides, you find out there if you have a lot of hypertension, a lot of infectious diseases, or a lot of musculoskeletal, or even suicide, mental illnesses, and the likes. And then, of course, we can do health surveys. I think this is done through APEs. APE is mandated in the Philippines. You cannot put up a company and not have an APE, okay? So use your APE, get the results, check who are obese, check who are hypertensive, check all your illnesses so that you can come up with programs, not to discriminate, but to come up with programs to keep your employees healthier. And then, of course, plan. And if you plan, tell your people about it. Don't keep it to yourselves, okay? Not just the HR should know it. Everybody should talk about it. Make it like your Facebook page or your Twitter or your Instagram so that everybody knows about it. And then execute a very good plan. Also, don't forget, I think in studies, and I will show you later, that people in the Philippines and elsewhere in the world want to have something in it for them. So win it, lose it to win it, something like that. You have to put something in it for them. Later, I will also show you what examples we have. And then, at the end of it, don't forget to evaluate your program so that you know where to kick off next time, or where you went wrong, or what you need to do next program. So, I've been analyzing a lot of data, and I will not mention where I got them, but most of the companies, especially BPOs and corporations in the Philippines, along with manufacturing companies, have the following illnesses. Number 1, a lot, because we're a tropical country, infectious diseases, lifestyle to include your obesity, hypertension, diabetes. Mind you, there's a new guideline now. I believe everybody should have read this on Facebook, that hypertension now is not 140. You're not anymore hypertensive with your 140. It's now lower. It's 130. You're hypertensive already when your BP is 130 to 139. That's stage 1 already. So be very careful. More of your utilization will go to probably hypertensive employees because the category has been lowered. Okay, so I think lifestyle will go up, and that would mean an increased cost of medicines, antihypertensive drugs. And then lately, I think it's because of the advent of a lot of those iced teas, caffeinated drinks, that we have a lot of genitourinary tract diseases. Examples would be your kidney stones, gallbladder stones, digestive tract. Before, you would have to be 60 years old to have stones. Now people are collecting stones everywhere, inside their body, and that's not good. That's because they're not drinking a lot of water. You might be wondering why I keep looking at my water, because I drink water like every few minutes. Because if you want to be well and pretty and beautiful skin, take water. That's it, just water. And then musculoskeletal diseases, very importantly, low back pains, mostly from what they do at work. So, what are the common interventions? Let me just share you. Usually, we do nutrition counseling. We share, we get the nutritionist to check what the company is eating. But lately, I think this is very effective. For a certain hotel that we're handling, we do themes every day. For example, Fruity Friday, no sweets Tuesday, something like that. So create an interesting program for your diet of your employees. Don't feed them with pizzas every day. Every blowout, there's some spaghetti or some high-calorie food. Try to give them something healthier. I think in one company where I did this lecture, they fed me with tuna sandwiches every time I did a lecture. And I'm like, why always tuna? I want chicken sandwich. Doctor, you said you wanted to be healthy, so you should just eat tuna. Really? And then one time I lectured on this, and then somebody gave me Sprite. And when I took it, because I didn't have water, they were saying, Doctor, why are you drinking that soft drinks? I'm like, I don't have a choice. But yes, we all have a choice. It's not because you're given soft drinks, you will just take soft drinks. Soft drinks is about 230 calories. And if you're just going to sit there all day, drink your soft drinks 3 times, that's almost 800 calories. And you only burn 80 calories by sitting down. So where does the other calorie go? Probably in front or at the back. Okay? So fitness is very important, although I know it's very expensive. Although I know also of some companies who put up their own fitness gyms inside their offices. I'm like, wow, cool. But you can also teach them the 4-minute workout. Have we taught them their 4-minute workout, Ms. Carmi? Later, I will teach you a 4-minute workout, which you can share with your employees. And I think one very big company is doing this every 3 o'clock. So at 3 o'clock, a bell would ring, music would sound off, and everybody dances the 4-minute workout. And it makes you lose 500 calories every time you do it. So yes, I'll share that later. And then stress management, of course, very important. Education, and some don't even have anything. That's poor. Anyways, common interventions in the Philippines, as I've mentioned, I think lately on-site clinic is very important. Although, based on DOLE, all companies with 50 employees and above should have their own clinic. Let me tell you that even if clinics are very expensive, these clinics, and Healthway is a testimony to this, where is Ms. Carmi? Healthway clinics are able to bring down utilization because people go to the clinics and the doctors help them with their own health. So proactivity. So we can centralize everything using the clinic. Promotion, well, this is from Jardine. They made me a good banner that we use for our clients. Email everyone if we have wellness programs. Keep reminding them, no? Be makulit about it. Keep nagging them about it in Tagalog. Common incentives, well, lucky for your company if they have cash payments or if they have vouchers. I think we did this for one big hotel where the winner of the wellness program for a 12-month period gets an overnight stay in their very posh hotel. So something like that, or they get to go somewhere else if they participate. And let me tell you later how you will make them participate. But I'm also happy to say that over the years, there is an increasing number of companies who are doing wellness and incentivizing. So you should have a budget for that. Or if you don't have a budget, get a nice paper, print your certificate, make them join, and if they join, they get some free, like a certificate of participation placed in a nice frame that they can hang on their walls. I mean, that for me is very important, signed by your medical director or your heads or CEOs. And then at the end of it, do a survey. Every time I lecture or do a wellness program, I'm not shy to give them my survey form, our survey form. I don't care if they put that I'm not good or if I'm good or what, but what is important is you see there that you have an impact. And most of the time, I would read there, Doctor, you have a very good lecture, but please add more of this and that. And that makes it better. Improvement is the key. How do we do it in Jardine? well, are there Jardine people here? No, but I'm sharing you what things we do, and they said it's good. So number one, we do the JLT Wellness Passport. I think I've covered the names of those companies who used it as, well, I designed it and then they redesigned it. So you can use a wellness passport that you can use from the beginning of the event. For example, in January, you will come up with a wellness program that will run for 6 to 12 months. So everybody gets a passport that just looks like your DFA passport. In fact, these passports in front are much better than DFA passports, than our Philippine passports, because you can stamp the HR or the clinic will stamp every time you join a particular event. For example, there's a lecture next week. Everybody who joins gets 100 miles, just like you're taking the airplane. So make them feel that this is something prestigious, that they are traveling and they will travel to venture into the world of wellness, and they get points for that. In fact, these wellness passports have BMIs. So look at this. In one part or one portion, you will put there their blood pressure, their weight, their height, their waistlines, and then they will keep it, and it will be monitored, of course, also by them and the clinic staff, so that they also see what's going on to their health. It's like a record, okay? So you can use that. I can share that to you. But what about clinic management? The HR cannot do it alone. Neither the CEOs. I'm not sure you can do it just on your own. But you can make good use of your clinic. You can ask the help of your clinic. I'm sure most companies here have a clinic, and you should have. At 50 and above, you should have your own clinic. Otherwise, Dole will inspect you and you will get some letters. Okay? So clinic will do the monitoring of everything, the wellness programs, preventive measures, and then, of course, APE assessment and monitoring of the employees. For example, patient A is hypertensive, then the doctor can always remind him or her to always come to the clinic for checkup. No? This will also cut utilization or use of HMO. They would always say wellness lectures nowadays are passé. They don't like it anymore. They're too busy. But hey, education is always the key. I used to be a teacher before I became a doctor. But always, if you know what you're talking about, if people know what's happening to them, then they will be aware. Of course, you can also do health advisories like what Jardine is doing. We send out email blasts. Also, Healthway is doing to their clients, so that very informative ways. And then I think this was also done in one company. It's called JLT Wellness Circles. You cannot put everybody together and, hey, let's Zumba together. Not everybody likes Zumba. Not everybody likes Pilates nor fitness workouts. So then we can share you a program that you can actually do it yourself. So you create groups, and then somebody leads it. There are programs that you can do, and then there's also ways to assess it. So it's called Wellness Circles. If you want, you can ask us how you do it. And then lately, we also do, because they say lecturing is passé, so we have to think of something. So we do film showing. Yes, we can show that. This is from one of our partners. We can share this to you. In areas of your offices, you can show this. I think this is not the latest blood pressure, but yes, at least you can show this instead of those telenovelas that you show in your pantry. You can show some good fitness, wellness videos, and they can dance. Thanks. That's it. Stop. Okay, so you can also do that. Or instead of getting fitness instructors, which can be costly, you can have do-it-yourself videos. You can show this in your any of your halls that they can dance. Yes, dance. This is the Nestle video. I think they allowed us to show this. So you can show some videos and everybody gets to dance. And lately, there has been a lot of companies, investing on webinars. I think this is also very particularly important to BPOs, because they would always tell me, "Doctor, we cannot stand up. We cannot leave our desks. We cannot stop what we're doing. So maybe you can try webinars." So you just need a very good IT system for this. One doctor lecturing, for example, I'm here, and you just televise this all over your sites, and then they can also ask me questions, and I can answer through the webinar. I think everybody knows about this. I'm almost done. Awareness programs are also very important. We partner with several companies. I think Generica is here. They're also into wellness programs. You can also keep in touch with them, and they will help you out with usually lifestyle diseases. Wellness fairs, I think most BPOs love wellness fairs because there's something in it for them. But these are usually just one-day affair or one-week affair, but it's a good kick-off. You can use it to start off your wellness program throughout the year. And then, of course, yes, you have a wellness fair, but keep it regular. I think in our company, we do it 4 times a year, every quarter. There's a theme for every fair that we do. And then blood screening, we've partnered with a very good company called Singapore Diagnostics. You can also keep in touch with them. They give free screening for cholesterol and RBS. That costs about $2,000, and if you can get in touch with them, yes, they give you that for like 5 to 10,000 employees. You just have to talk with them, and they screen your employees and give you a very good result. That's their company. In an app, very good. 24 hours, you get your results. And then, of course, I'm a researcher. Vaccination is still the key. The very important vaccine that you should introduce to your employees, if you still don't have, is at least the flu vaccine. And you cannot just do it every January, February, March, April, May. You can also do it at this time of the year where the cost is so much less. It's cheaper. So you can still have your vaccination period even up to now because the cost will be less, and there's a spike of flu because it's cold in the Philippines. Okay, actually, this is my last slide. There are 2 slides that I want you to remember. Number 1 is the steps to wellness. And lastly, this slide, which summarizes everything I said. So my key point or takeoff for you guys is the word brand it. In everything or anything you do, my dad, my father, who's a marketing specialist, would always say, brand it. You should have a brand. And even your wellness program should have a brand. So number 1 is brand your wellness program. Make it sound unique, sound interesting, so that even if people don't like it, they will choose to attend. You know, just like Twitter or like Facebook. Just come up with a nice story and people would like it, you know? So do it like that. Benchmarking is also very important. And then remind your employees that there's such a thing as a wellness program. I think the very important thing that Mr. Prado mentioned is that they keep reminding their employees about it. It's part of their life at work, you know? So regular prompts and reminders. And then please, guys, I know you guys here are CEOs, heads, medical directors, and all. Join it. Be the first one to do it. Be the initiator. You know, actively participate. Honestly, I'm afraid of blood. The very reason I became a doctor is I wanted to overcome blood. And so every time there will be a wellness screening and a blood donation drive, I would be the first one to donate and give my own blood, even if I was sweating all over and really jittery about it. But hey, initiating is the key. Somebody should start it, okay? And then notify everyone, keep reminding, and be definite about it. Tell them that if you participate, then this will be better, not just for our company, but for everyone. And then internet, social media, very important. And then lastly, I will take a deep breath. Track, monitor, and measure whatever you do. Because there's no use if you don't analyze what happened after all. So I always say when I is replaced by we, even illness in that word becomes wellness. Cheers to wellness, everyone. Thank you and good afternoon.